COVID-19? Well, I think the first thing to get across is that it's not as severe an infection as some of the worst reports are suggesting. 95% of people who get COVID-19 have a mild flu-like illness. 5% of people who get it can have a more significant illness, but they generally are older patients with significant comorbidities. So probably the best message to get out, whilst we are concerned and we are planning for having more infections, it's not as severe as perhaps the worst reports are suggesting. It's best to think of it like a seasonal influenza that we have every year. In Australia, we have up to 200,000 people get influenza per season, and in a bad season, there might be 1,000 people who have an illness that causes them to pass away related to influenza, and we're not expecting COVID-19 to be worse than that. The mortality rates are probably going to be around the order of 0.5 to 1%, so much lower than some of the initial reports. From a local point of view at the hospital, we have already got strategies and practices in place to deal with cases who present that may have been exposed. At the moment, that's isolated to people who've travelled from countries where transmission rates are high or moderate, or they've been exposed to a case of COVID-19. Well, when there's only 50 in Australia at the moment, the chances they will have exposed is small, but we're obviously wanting to look out for cases if they occur. At a hospital, we're planning for a presentation now for how we should admit patients, and we're also planning for what happens if the numbers go up, as we do every year in influenza season. If it's a particularly bad flu season, we have what's called the pandemic plan, and we're already looking at putting that into place if we need to, but at the moment it's not in place. Yeah, look, I think we've had a number of patients who've presented who we've had to work through as to the risk assessment. We've had no confirmed cases in Warrnambool at the moment, but at any one stage, if you ask any hospitals, a number of patients who perhaps might be waiting for testing. We've had a few bad flu seasons, and we'll remember the swine flu, and that has prompted constant updating of our local plans as well as at the statewide level. We think that the infectivity of COVID-19 is perhaps just a little bit above standard influenza, but the mortality rate is looking very similar to some of the higher end influenza seasons. So it's very similar, even though it's a different virus. The actual way that it's affecting people in the community we think is going to be similar. It's unlike influenza though, it is a new form of this virus, even though we've got coronaviruses in our community all the time. It is a newer form, and therefore people don't have the standard immunity to it that they might have otherwise. But the previous flu pandemics and problems have allowed us to be well prepared. We may also be looking at recommending early influenza vaccine. We know if you've got another respiratory infection and you get COVID-19 on top, that can increase your risk of getting unwell. So there is a move to think about early flu vaccination, perhaps about a month earlier. Mid-April is sort of what's being talked about now, whereas it normally would be a month later, so that if we do have a rise in COVID-19 cases, we'll hopefully be on top of our influenza at that point.
What are the key things people should be doing all the time to be more preventative?
So as you say, droplet infections, most of the time people don't get directly coughed into your face, but that obviously can happen, but it's a low risk. So otherwise, as Susan points out, if you touch a surface where the virus may have been, the virus we think can live on surfaces for a number of hours. No one's quite sure how long, but the most likely way people get infected is they touch some surface where the virus is, and then they'll touch their mouth or their nose and infect themselves. So trying to avoid touching your nose and mouth and face, it's easy to say, but it's something you can practice.